Good afternoon, and thank you for joining us. As we enter the fifth wave of the COVID-19 pandemic, Israelis are looking to the national medical community, whose staff have worked tirelessly to treat the ill and prevent a deterioration of the situation, for answers. Joining the Jerusalem Press Club today for his analysis is Professor Jonathan Halevy, president of Shaare Zedek Medical Center in Jerusalem, who previously served as its Director General for 3 decades. Thank you so much for being with us, Professor, in these busy times.
You're most welcome, Talia. May I start by introducing myself, and then I will give you a brief view, my personal view on the current situation of COVID in Israel, including the 4th jab that we are offering to the public, to the high-risk public. So I'm an internist gastroenterologist and also board eligible in health administration. I'm an associate professor of medicine and gastroenterology here in the Hebrew University in Jerusalem. And I was, all through my managerial career, I was also an active clinician and very involved in lecturing, especially around Israel, but also outside Israel, on issues of medical ethics, health administration. And during the current COVID epidemic, especially Channel 12 adopted me as one of few commentators on the epidemic that he uses. I'm also a member of the Tzatam, the health ministry a team that advises the Director General and the Minister of Health, Director General of the office, the health ministry, and the minister himself on epidemic issues. So that's my my background that fits today's presentation, which I will try to make very short and devote most of the time to receive questions from yourself. So as you know, we are facing a new variant, the Omicron variant, started in South Africa. We already know many things about Omicron. When comparing it with the previous variant, Delta, and even the original variant that is called now the wild type COVID, the original one that started. Since then, we had few of the Latin alphabet variants. And what we know about Omicron is that it spreads, I'm sure you're all aware of it, it spreads much quicker. It can infect people who are triple vaccinated, definitely who are not vaccinated at all or only partially vaccinated. The only difference is that people who are triple vaccinated so far, and that's the impression from South Africa, from Great Britain, from Germany, and from France. We don't have this impression in Israel because we are only seeing the first few thousand cases here in Israel of Omicron. But we do know from those countries that triple vaccination confers a very significant protection against severe disease. Now, when one talks about severe disease, one has to define what is severe disease. There are 2 levels of severity. There is the WHO and the Israeli Ministry of Health Administration to a severe case, which is any patient who needs oxygen support. And whether he needs the oxygen supports on an ambulatory basis, to have a nasal cannula, the simplest way to administer oxygen, he gets it for a few days and he overcomes the disease, he is still called a severe case, or whether he needs to go on a respirator with artificial respiration in an intensive care unit, and sometimes even in need of an ECMO. ECMO stands for extracorporeal membrane oxygenator, a machine that really replaces on a temporary basis the work of the heart and lung. It could be either one of them or both of them if they go out of action because of COVID infection. It is of note that the Omicron causes less lung disease. The symptoms are a little bit different, but it can bring patients to intensive care unit and to artificial respiration. What we don't know about Omicron is really how aggressive it is. And the main question, and I think this is the question that stands today in the center of public interest here in Israel, whether a fourth vaccine, a second booster, fourth vaccine will confer immunity against significant, clinically significant disease over and above a vaccine, the first booster, the third vaccine, if it was administered over 4 or 5 months ago. We don't know the answer to this question. Had we known the answer to this question, and it would be positive, meaning that the fourth vaccine has significant added value over the triple vaccinated in protecting from severe disease, the fourth vaccine is a must, and I will tell all of you to rush today to get the fourth vaccine. Israel does not offer it to everybody. So far, it offers it to 3 groups of patients or of people. All of them are healthy people. Not all. The first group is those who are immune suppressed, people on chemotherapy, people who suffer from autoimmune diseases and are getting immune suppressive agents, people who are transplantees, had organ transplant, and have to take all their life, have to take an immune suppressive therapy. All these patients are the first group that this medication was offered to in the middle of last week. The 2 other groups that were added yesterday morning, or I think even on Sunday morning, were those over 60 and those who are in medical personnel and work with patients, because these 2 groups, the elderly, are more prone to severe disease. Nobody knows if from this variant as well, but probably yes. And medical staff, it's obvious we take care of the patients here, and it's the interest of the public that there will be less infections among medical staff. I must tell you that from looking at what happens during the first 2 weeks that the Omicron is with us, I think the main problem of hospitals in Israel is not going to be the overload of COVID patients with overwhelming our resources in intensive care unit beds and so on. Our main problem is going to be staff that will be under quarantine, and we will not have enough people to take care of the patients. And this is at the peak of the winter, when the flu epidemic is not at its height. You know, last year, 2021, it was near 0 because of the social distancing. We are now the rate of influenza and its impact on hospitals, on internal medicine departments and intensive care units. According to recent publication of the Ministry of Health, the rate of influenza, the scope of the influenza epidemic is midway between 2019, when there was no social distancing at all, and 2021, when there was maximal social distancing at the peak of the 4th wave in the winter, and everybody wore a mask, and people really refrained from convening in places with many people, going to theaters and restaurants and so on. So we are midway between them, and my worry regarding the present variant is mainly because it spreads so quickly that we have many of the staff that will be affected right now. Even in my hospital, Shaare Zedek, which is a 1,000-bed hospital, we have around 60 or 70 nurses, physicians, paramedical personnel, cleaners who are in quarantine. Because we have a workforce of 5,500 people, few tens is not a problem, but these few tens may become hundreds very soon, and this is my main worry. Will the 4th vaccine protect from this? We don't know. It probably does not give you much protection from being infected, but it gives you the 3rd vaccine, and probably the 4th with added value, we discussed it, gives you protection against severe disease. Now, the situation is so worrisome that the Ministry of Health is considering, and probably it will be issued within a day or 2, different regulations for quarantine for medical personnel, probably essential medical personnel who take care of patients, not only COVID, all patients, and they have no replacement, will be able to come to work if they are asymptomatic. Someone with symptoms that even raise the suspicion of COVID should not go out of his home, only to do the PCR test. But those who need quarantine because they were exposed to a child that came from school, or even to a spouse, will be able, it's not in effect yet, but it's in the planning and probably will be published today or tomorrow, will be able to come to work, but to do an antigen test every morning. And if the antigen test, if you will now like information about the difference between PCR and that antigen test, it's widely publicized, but if you have questions regarding that, I will be happy to answer. So these employees will probably have to do an antigen test every morning, which will give them clearance for the next 24 hours. So if to sum up what I said so far, yes, Israel is at the beginning, not the peak yet, of the Omicron variant wave of COVID-19. It's this variant is characterized by very, very rapid spread. Probably no one is protected from infection. But on the other hand, the vaccines, even the triple vaccine, confers immunity and significant protection against severe disease. That has been shown in all the countries where Omicron prevailed. It's very difficult for Israel to conclude anything from South Africa because it's a completely different society, much younger, much higher rate of recoveries from COVID and much lower rate of vaccinees with COVID. But Great Britain is more similar to Israel in terms of the age of the population and in terms of rate of vaccinations and rate of recovery from COVID. And what we hear from there is huge number of patients who are verified with Omicron COVID every day, huge numbers between 100,000 to 200,000. And if Great Britain has a population of about 70 million and we are 9 million and you extrapolate the number, let's take 150,000 and divide it by 9, by 8 or 9. So we can expect here between 15 and 25,000 patients verified daily in the next few days. So these are the issues. I mean, how many of these patients will reach the hospital? My prediction, and anybody who tries to predict with this epidemic is really risks his neck. But I will try to predict that, yes, we will have over 20,000 patients verified a day, but like in England, we will see only a small fraction of them coming to hospital with severe disease, and our resources will not be overwhelmed. That's the first issue. The second issue in the summary is the fourth vaccine, the fourth jab. Should we recommend it or not? Israel offers it, of course, free of charge now, only to immune-depressed, medical staff, and people over 60. My personal advice is that anybody, of course, as medical personnel, the vaccines will be supplied to my hospital, Shaare Zedek Medical Center in Jerusalem, this coming Thursday, day after tomorrow. And having to serve as role model, I, of course, will take the vaccine immediately on the first day. Do I advise to anybody over 60 to take the vaccine? I'm not sure. I believe if there are background diseases, and by background diseases relevant to COVID, I list severe obesity, hypertension, whether well-balanced or not, diabetes, whether well-balanced or not, and any lung disease with smoking in the background or no smoking in the background. Those patients I would recommend to go today and get the vaccine. All the others, I would still wait to see, and this will be very clear in the next few days, if really how much those who are triple vaccinated, even if they took the third vaccine 5 months ago, are still protected from severe disease. If I will see in Israel in the next 24, 48, 72 hours, more than 10 patients without severe background disease that were triple vaccinated and admitted to hospitals with severe disease, with a danger for need of artificial respiration, I would urge anybody over 60, even without background diseases, to rush and get the first vaccine.
Okay,
that's what I have, in the way of updates of what's happening now in Israel, and I'm glad to open this presentation to questions.
Okay, very clear. Thank you, Professor. You've packed in quite a lot of information into your briefing, so I'm going to try to pick apart a few things that have come up in the questions sent in over the last 15 minutes.
I didn't look at the messages, but now I can.
No, you don't need to look at the messages. Everything's fine, and a lot of questions have been sent in through other means. So I'm going to try to sum them up for you to make this as efficient as possible. But the bottom line, as you said, in the peak of the this current wave, we're looking at around 20,000 daily cases. Having said that, what do you think should be done in terms of testing? Should everybody who's symptomatic or everybody who's been exposed be tested, or what are your thoughts?
Well, as you know, even yesterday, the capacity for PCR testing was quite overwhelmed. People were waiting hours in line, and this, of course, will be more and more severe. So I believe the first rule is that anybody with symptoms that may raise the suspicion of COVID, and I must say that with Omicron, we see a lot of sore throat. That's the first symptom, much less loss of taste and smell. But of course, if one feels the loss of taste of smell, any fever, any chest pain, any unexpected cough, not a cough that comes from transient aspiration of something, but really a coughing that lasts for hours. First of all, I would isolate myself. I would contact my family physician and try to find out what is my options for a PCR test, whether at home or to go, as far as without exposing myself to the public, to do a PCR test. An alternative is to use a home antigen test. Now, the antigen test has between 70% and 80% accuracy rate. It also depends on which type. There are about 5 commercial types for the antigen. They could be used at home. You have to read the instructions very, very carefully, because the intensity that you take the swab from inside your nose also has an implication. So this is the best if PCR test is not available. And that would be my advice, because with 25,000 patients verified a day, not everybody will be able to do a repeat PCR test later on. So those who did and were verified, these 25,000, of course, should go into isolation and a quarantine, which right now is dictated as with 2 negative PCR tests 5 days after the symptom elapsed. I'm not sure that the Israeli healthcare system will be able to supply a PCR test to each and every one of these people. There are countries with really Omicron affecting them, mainly in Europe, that let you leave quarantine far, but in Israel it's not so officially, but the government may reach it if we will see that we are in insufficiency in supplying PCR tests. But there are countries that allowed leaving the isolation, leaving quarantine 5 days after the symptoms ended, even without a negative PCR test. Okay. That's not the situation in Israel yet.
Many of your colleagues have spoken out against the government's latest move to reduce travel restrictions into the country. We know that in less than a week, they'll be letting in tourists from specific areas. They say that this is a recipe for increased morbidity. Do you agree? And what are your recommendations on this end for decision makers?
I disagree. I must say that the present government, and I'm not talking from a political position, I'm a totally apolitical person, but I believe that the present government found the right balance till the Omicron, and I also approve of their steps during the Omicron, and I will explain in a minute. But the government is 7 months old, almost 7 months old, and from the beginning, they tried to find a new balance between the health needs of the population and the social economic needs of the population. And when I say social economic, I do not mean only personal remuneration and how people make a living, which is extremely important, but I'm also talking about the impact on children, the impact on development and education of children, the psychosocial impact on all of the society. So they declared from the beginning that they will not declare a national quarantine, a seger laumi, and they continue declaring it during the Omicron, and I think it's right. The government was right also in closing the airport when the first signs of Omicron started to spread over Europe, and I believe that we bought a month for this in order to organize ourselves, that the import of Omicron to Israel was delayed. Once there is such a widespread community infection, the imported cases are irrelevant. And that's why if we want to keep the finances going, the Israeli market thriving as it was in the last 6 or 7 months, and we want to refrain from exposing our children to Zoom learning, to learning from home with all its negative impact that was not researched enough yet, but I'm sure we will have surprise how big is the impact on children. I approve of the government steps to leave the Israeli market open, to leave the schools open, and even to open next week the airport for tourism from non-red countries. I think it's very important for large segments of the Israeli market in order to keep them viable after a long time where they could not make a living.
Okay, very clear. Part of the organizational efforts that you indicated that the government made during the initial closure was to import COVID medication to Israel, but we know that the medication needs to be given early on into the disease. But on the other hand, people are being instructed to stay home unless they have very serious symptoms. So how does that align with the process?
You're talking about the Paxlovid, the new medication of Pfizer. So the solution is quite simple, and it was already implemented for a few patients yesterday in Israel. We can define who is prone to severe disease. Actually, it's the definitions that I gave for those that I urge to get the fourth vaccine today or tomorrow or as soon as possible. And these patients in contact when they are at home without severe disease during the first or second or third, preferably the first and second day of their symptoms, should contact their family physician. And if the family physician defines them as high-risk patients, and they'll do it for every elderly patient with significant background diseases, the medication will be sent to their home. There were already few patients who got it yesterday.
Okay, you mentioned the issue of children, that of course we're all thinking about it. And we know that children are actually sources of contagion. Do you think that the government's stalling in instilling a school vaccination campaign when it became available to each age group is one of the reasons we're here today? Would it have helped if children were vaccinated earlier at school?
I I'm not sure I follow you. Your question was the government right to recommend to young children, like from 5 to 11?
No,
to
was
get
the government, at least it's been several weeks since the vaccine, actually more than that, it's been around 2 months since the vaccine was available for younger children, but there was a lot of stalling in having those vaccines available at schools in order to encourage.
I'm not sure you are right. I understand the question. The question is about the stalling. So I think you are referring to the position of the Minister of Education, Ifat Shasha Bitton, who was against giving vaccinations at school. But I don't believe she was overruled immediately and vehemently, and I don't believe there was much stalling. The stalling stems from the hesitance, which I understand. I don't justify, but I understand the hesitance of parents to give vaccines to such young children. That's why majority of children between 5 and 11 are still unvaccinated till today. It was not the stalling of the government, it's the stalling of the parents, which I cannot condemn, and I can understand that, but I believe that there is enough scientific evidence. We are not talking about the 15,000 children that were part of the Pfizer, 15 or 30, I don't remember, 1,000 children that were participants in the clinical trial of Pfizer that led to the emergency approval by the FDA. I'm talking about close to 10 million children between the ages of 5 and 11 that were vaccinated in the United States and European countries so far. And we know for sure that the short-lasting complications, short-range complications are near nil. This myocarditis is usually, it's very rare, very mild, and probably 1/6 to 1/10 of the chance to get compared to getting myocarditis from COVID itself. So I would not worry about the side effects at all. I can understand that some parents say, we do not know the long-term complications, whether such a young child, 5, 6, 7 years old, will not develop 20 years from now an autoimmune disease because of this vaccine. So as I said, and I'm saying it for the third time, I can understand the hesitance, but it has no scientific basis. First of all, there was no vaccination in history that led to complications long-term, more than a couple of months or 4 months after being administered. Second, the mRNA molecule that is produced in the laboratory by recombinant DNA technology disintegrates 24 to 48 hours after being injected into the body. All the scientific knowledge and research sees no connection and no logical connection between autoimmune diseases and this specific vaccine. But again, I'm not surprised that a large segment of this age group was not vaccinated because the hesitance of the parents, and I believe the Ministry of Health has to go on with their campaigns, and they're doing it. You see every day on Israeli TV, prominent pediatricians, including the chairman of the Israeli Pediatric Society, appearing time and again and urging parents not to worry and to give the vaccine. But I would not accuse the government in stalling.
Okay, we have time for 1 or 2 questions on our end. We did promise to finish by a certain time. One reporter is asking what the ratio of vaccine between medical staff and the general population. The assumption is that more of the medical staff are vaccinated than the general population. Do you have the statistics? Maybe in your hospital specifically? Well,
medical personnel, especially those in hospitals, I have no statistics regarding community physicians, but medical personnel in hospitals, and it's no wonder because we see the tip of the iceberg, the most difficult patients with COVID. So every hospital in Israel reached between 96 to 99% of vaccination rate among medical personnel. We know that the high-risk groups, and medical personnel is a high risk, it's high risk to infect and it's high risk to be infected. But we know that patients over 60 in Israel are now 93% vaccinated, but not triple vaccinated. If there is a puzzle in the Israeli vaccination arena, the puzzle to me is how come that around 1.5 million people who took the first 2 vaccines didn't bother to take the third one. And this is really a puzzle. But regarding the difference between medical personnel and the general public who is elderly and at high risk, it's few percent difference between 92, 93% to 97 to 99%.
Very interesting. And just our final question, a little closer to home. We know that Jerusalem specifically was a kind of hub of infection in the earlier parts of the pandemic, largely due to the large ultra-Orthodox community and the Arab community, both of whom were a little bit more hesitant when it came to vaccines, and perhaps we saw some other phenomenon related. Looking almost 2 years into it, do you see that things have changed? Are efforts to educate these communities fruitful?
Yeah, things definitely have changed. I don't believe that they will be prominent in the Omicron. The official numbers is Jerusalem is the leading place in Israel now with verified Omicron, with true for yesterday, over 4,000, but Jerusalem is the largest city in Israel. So if you take Tel Aviv, the proportion is about the same. And I'll tell you in my logic why we are not prone to see peaks, especially among the ultra-Orthodox Jews and the Arab community. These two populations are characterized, we have to admit the truth, by the fact that they have issues with the government. The ultra-Orthodox with Zionism and the Arab with the state of Israel. These issues led them and leads them till today to have less trust in the government. That's why they were the last to keep social distancing over a year and a half ago. They were the last to be vaccinated. By the way, it gives them an advantage now because many of them got the third vaccine much later and not in early August when it first appeared. But I think that these issues, although they were not resolved in principle, but in a year and 9 months of epidemic, these groups of patients realized that if they don't want mass infection with many victims like they had in the first and the second wave, they should be vaccinated and they should keep social distancing. And we see it among these two segments of the population now. They are putting masks no less than people in northern Tel Aviv or in other communities, and they are getting the vaccines. We don't know yet what will be the statistics with the fourth vaccine.
Okay, very clear, Professor Jonathan Halevy, president of Shaare Zedek Medical Center in Jerusalem. Thank you again for your time.
You're most welcome, and may we hear only good news.
Amen, amen. And thank you to JPC Director General Uri Dromi and to Eli Klutstein, JPC's press coordinator, for facilitating this call. May we all have a healthy new year. We hope you enjoyed that briefing by the Jerusalem Press Club. If you did, like the video and hit the subscribe button to stay up to date with all of our future content.